Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. The percentage of adults with a mental illness who report unmet need for treatment has increased every year for over a decade. In 2019, almost 25% of adults with a mental illness reported an unmet need for treatment. Today, over 60% of youth with major depression don't receive any mental health treatment at all. Part of the problem is that people don't know what their options are or how to access those options. Public mental health services and systems are publicly funded, financed by Medicaid and grant funds, which are in turn financed by taxes and other types of state and local revenue. In other words, you're probably already paying for those mental health services. So it's important for you to know where your dollars are going and how you or your loved ones, if you're eligible, can access those services should you ever need them. During this Brother Be Well conversation in our Parents and Caregiver series, made possible by the support of Blue Shield of California's Blue Sky Initiative, we're exploring California's public mental health systems. My partner for this conversation, marriage and family therapist and Brother Be Well clinical advisor, Christian Jacobs. Christian, love talking to you, and this is going to be a deep one.
Yeah, most definitely. Thanks. I appreciate you all for having me back again.
Always good to have you. Let's dive right on into this, Christian, if you don't mind. The public mental health system, as you know, is a network of mental health agencies and professionals that provide mental health services to eligible people independent of their ability to pay. It dates back to the 1960s and was designed as a safety net to get people the help they need no matter what their circumstances are. We're going to focus this conversation on the state of California. That's our home state. But it's important to note, and we'll mention this a couple of times, check with your own home state, and you'll get some tips during this talk about just how to do that. Here in the state of California, the Mental Health Services Division, or MHSD, administers a number of mental health programs for children and youth, adults, and older adults. They're funded via Medicaid and the Mental Health Services Act, which was passed in 2004. Kristen, do you mind giving our viewers and listeners a brief overview of the MHSA and the services that are provided by
Sure, Michael. Well, the MHSA is basically just imagine there's a pot of money that's reserved for mental health services for county agencies to use. So, for example, some county agencies, one of that pot of money is set aside for prevention or early intervention, meaning using funds to prevent the mental health conditions and intervene and identify those issues early on before it makes a significant impact in a youth's life. So that's one example. And the MHSA, as you were talking about, how it passed in 2004 and is funded by a 1% income tax on personal income. And so for anyone making $1 million per year, they're taxed one per. They get that they get that tax in terms of 1%. It's also designed to expand and transform California's behavioral health system to really better serve individuals, with who are at risk for these serious mental health conditions. So MHSA really addresses that broad early intervention, the prevention I was talking about earlier. For interventions such as group therapy, individual therapy, family therapy, more intensive outpatient therapy systems, and also inpatient systems as well. So in real life, to paint the picture for you what that looks like, how that money will be used. If a child is receiving mental health services through Medi-Cal, and that child receives, say, for example, a bus pass to get to therapy, uh, those MHSA funds are used or utilized or can be utilized for those type of things. Or, for example, the child receives an incentive for coming to therapy, like a $5 McDonald's gift card or something like that. So the county does pay for things like that through MHSA funds.
You mentioned Medi-Cal, so let's get right into that. That's California's Medicaid program. How does one go about qualifying for Medi-Cal, Christian?
Well, Medi-Cal eligibility is really based on a couple things. So it's based on your family size and also your income. So there are also some other uh, exemptions, such as conditions that are existing conditions that are already going on with that patient or beneficiary. So medical conditions, good example, that may make you eligible, such as being an elder, so being 65 or older, or having a specific disability may qualify you for Medi-Cal benefits. Or if you're pregnant, you need to receive prenatal services, go to the doctor to get checkups. That's also a qualification, and some certain age criteria too. So if you're under 21, if you're a youth who's in the foster care system or emancipated youth, there's several other categories that are also listed on the website. So we go to Cover Cal, which we'll talk about later, just to name a few. If you're also enrolled in certain programs such as CalFresh, so if you're receiving certain benefits for CalFresh or Social Security or SSI, or if you're in the foster care system, or actually they provide also services for individuals who are receiving a refugee assistance. And there's constant legislation coming out to cover different existing groups right now. So you may receive Medi-Cal in those situations too. And you can also visit www.dhcs.ca.gov and go to the Medi-Cal page to review their full criteria and ways to apply. So they list all the criteria and ways to apply online as well.
Christian, I'm going to trouble you. I'm never really ready for the wealth of information you provide. Can you give that website out once again and just a little more slowly for our audio podcast listeners?
Sure, that's www.dhcs.ca.gov. That
Really?
site will give you the background for Medi-Cal, and also you can go to www.coveredcalifornia.com. That's COVERCA.com. And those sites will basically give you the information so we can apply online on that Covered California website.
And we're going to get to Cover California in just a second, but I appreciate you giving those out. Um, Certainly appreciate that, Christian. In addition to connecting California residents with brand name health insurance under the Patient Protection and Affordable Care Act, Cover California, we were just talking about it, connects state residents with Medi-Cal. That website, you just gave it out. I think it's covered, COVEREDCA.com. How exactly does it work? And is there a fee associated with that? Do you have to pay to join Cover California?
Well, so Medi-Cal is a health coverage, just like the coverage offered through Cover California. So that's the first question people may ask. Is it a fee for Medi-Cal or Cover California? So Medi-Cal provides benefits similar to coverage, coverage options available through Cover Cal, but often at a lower to no cost for you and your family. So again, they base the amounts off of your income and your situation. After you go through the application to ask you those questions and some of those exemptions, and also your family size along with the income. So it's a formula that they use. But so overall, for most individuals, especially fall within those certain criteria, there is no fee. By going to their site, actually Cover California, they actually, if you go to the site, it allows you to apply for that health coverage and Medi-Cal at the same time. So you can apply it to both of those, pretty much doing the same application. And they're streamlining their system was what they're trying to do. And you can submit one application, and they'll let you know whether you qualify for both, or they'll notify you whether you only qualify for one of those programs. So they also inform you of what you need to apply to the other programs, such as Social Security information, tax documents, and other personal identification docs. So you can have all that stuff in one area when it's time to apply. There's also a list of, I was talking about earlier, qualifying events is what they call them. Qualifying events is basically if they occur within the last 60 days, you may qualify for Medi-Cal, Cover California. And those are also listed on their site. For example, it could be a disaster, an emergency that it may have happened, a local emergency. So there's also some qualifying conditions that may qualify you more instantly too.
It's a great site. Keep it in mind, coveredca.com. Appreciate you sharing that info, Christian. Once someone qualifies for and has joined Medi-Cal as a member, one is eligible for a lot of the mental health services about which we've been talking about on this platform, including individual and group counseling. What are some of those other services, Christian, that are covered under Medi-Cal?
Yeah, there's a lot actually. There's a lot of services that are covered under Medi-Cal, and once you get into the system, and once you're provided a treatment plan, so they can see exactly what you need, more people learn exactly what's involved. But services covered through Medi-Cal really include, that outpatient mental health services such as individual and group counseling, as we were talking about earlier, the outpatient specialty mental health services, that really addresses mild to moderate, sometimes moderate to severe, depending conditions, depending on the situation. Inpatient mental health services, so on Stockton Boulevard, the mental health treatment center, right there on Stockton, they have inpatient mental health services there that you can go to in the event of emergency or a crisis situation. That's also Medi-Cal covered. Outpatient substance use disorder services, so individuals who may, we talked about, substance use before in clinics and things of that sort. So narcotic treatment centers are also covered under some of those Medi-Cal systems too. So if you need to, you're trying to wean yourself off of a drug or a medication, or receiving treatment, that may be covered too. Residential treatment services, and also that voluntary inpatient detoxing. So you got outpatient and inpatient detox as well. So those are just a few of those services. There's several others. Prescriptions, so receiving prescriptions, and maternity, emergency services, rehab, so the occupational therapy thing. So it really does cover pretty much the whole person care, the whole body in terms of your needs. And also those pediatric needs too, for the little children who need services as well. So it covers the whole family.
It's a fantastic resource, and appreciate you sharing all of that info, Christian. I don't know how you keep it all straight in your head, but we're thankful to you here, Brother Be Well, that you do. As access to public mental health services varies so widely across counties and states, and we touched on this at the top of the show, we're going to focus this conversation on our home county here in Sacramento. I'm wondering, how does a Medi-Cal member here find a therapist? I would imagine a lot of people are at that point. They've signed up, they know they've got Medi-Cal. How do they go about the process of finding a therapist within that program?
Right. So as we speak, the mental health delivery system is evolving, or attempting to evolve every day by making it more timely and efficient and effective. That's one of the main complaints that sometimes you'll hear, is the timeliness of services. So really, you can first start by, even before you get that referral, start by asking for a referral from your primary care doctor, or your behavioral health provider. So if you're already, if you're seeing out of pocket, maybe a private doctor, you can ask for a referral. Or if you're already in a commercial health plan system, a Kaiser or something, you can ask your doctor to refer you based on what network they're using. And some health plans, you may be able to make an appointment directly with that healthcare provider. So they may provide you a list. So after you reach out, you call the access line through Medi-Cal. They may provide you they may provide you a provider list where you can reach out, or B, they may hook you up with someone automatically. It's good to find that out ahead of time and ask them that question. Actually, in other health plans, you need to first get that authorization from your primary care doctor so you can be referred. So for, as I was saying, Sacramento residents, Medi-Cal members can call the 24-hour access line. That number is 1-888-881-4881. You can request an assessment and a therapist referral and go through the system in terms of assessment process. So that's also it also switches over to a 24-hour hotline after a certain hour or two. So it's basically 24 hours. Someone will get a hold of you in terms of that service and support provided.
You make my job so easy, Christian. So I'm going to ask you to give that toll-free number out one more time.
Sure, that's 1-888-881-4881.
Really appreciate that. And if you happen to be here in Sacramento County in the 916 area code, that number is 916-875-1055, 916-875-1055 for the Sac County access.